nowadays about data strategy and about European data spaces and special European health data space, how to connect our information systems between different member states. It would have been very important to manage this crisis if you have this European, if you had already these European health data spaces. We discuss ethical and regulatory frameworks for AI. We discuss a lot of that to ensure products and services are innovative. Innovation, of course, is a concern, but respect fundamental rights. We discuss about the concepts of data donation or data dividend to involve patients, that is the owners of data, my data, to involve them in the projects from the beginning, and at the end to share with them the results. And the next 6 months will be rich in legislative proposals from the European Commission and discussed in the Parliament in these areas, and I welcome your expertise, particularly in the health field, to help in your work. Please feel free to use my email for that purpose. My email is in my personal page, and I'm always available to share documents, to hearing from you your opinion, because we need expertise to have good decisions at the end. The work we are doing on digital and AI regulation might be shared and must be shared with other countries from the very beginning, in a kind of co-design, co-construction of the principles, at least for the principles of future legislation on digital services, on data, on AI. And taking into account GDPR experience, I have been working on this idea with Latin American countries, and I'm very, very, very glad to have this discussion with other partnerships, with other partners, and special, of course, with India. I was in India in 2017 when I was minister in Portuguese government, and I participated in a conference on Digital India. And I also signed, after that, an agreement with the Prime Minister Modi during his visit to Portugal for cooperation in the modernization of our public services using digital tools and, of course, using data. I saw India is using digital tools to empower people and to accelerate development. And I share this vision about digital. Digital is for empowering people to improve our service, accelerate development, and not only a matter of market. And since 2015, also the European Union and India have along the years committed to work together on international ICT standardization, on cybersecurity, very important because we speak about European data spaces, but we need secure our data, on internet government research and innovation, of course. Moreover, the two regions agreed to advance business-to-business cooperation through increased presence of Indian companies in the European Union and the other way around, European companies' participation in India digital program. The roadmap for 2025 of the European Union-India strategic partnership mentions specifically healthcare in several points, with promises such as the promotion of technical and regulatory cooperation on healthcare, or the strengthening of partnership in R&D, in research and development, in the areas of health, bioeconomy, infection diseases, chronic diseases, epidemic, and so on. So there are a very good framework to work together, not only in research, not only in innovation, not only in developing our market related to health, but also in the regulatory framework in order to have to keep the trust of our citizens. It is clear so that European Union and India, the two largest democracies in the world, are committed to work together in the digital transition and share values and priorities. So there are many opportunities here to increase the cooperation in digital health field, and we need cooperate in digital health field. And for myself, for my side, I'm totally available to fully support these efforts and the European Parliament, and of course to work in the InfarMed, special in this project of European health data space, because I think we need to start to organize ourselves to participate actively in this project, not only to take advantage of the results, but also to be active partners of this project. To sum up and to conclude, so digital transition is a priority for European Union and of course all the member states, and of course for Portugal, and also this is a priority for India government. Both regions are focused on health innovation based on data and AI, and both regions have a lot of very good projects that are being developed concerning data and AI, prototyping new services and new products. But we want a responsible use of AI, human-centric, respecting human dignity and respecting our values. So robust principles and legal and ethical framework are needed to keep citizens' trust on innovative health products and service. If we progress together in this path, we can go faster, empowering our people and improving their well-being and quality of life. Thank you very much.
Thank you so much, Dr. Maria-Manuel Leitão-Marques, for your thought, leadership, and in this setting up the directions, and also for hope on the need for international cooperation and the doors that we are now seeking into India. And your past experience with India and Prime Minister Modi is definitely an asset. I hope you can be part of the Health Data Forum initiatives in 2021 to make this a reality, and have, why not, António Guterres, our former Prime Minister, which was the first Prime Minister who hosted India in Europe, in Portugal, a few years ago, I think, in 2000. It will be great if you could have your good intermediation to also invite him here. Next year, we have António Guterres with us and celebrate 20 years of relationship within EU and India. And it will be definitely a very good moment that we should start thinking about, and hopefully without the crisis of this pandemic anymore on top of us. Thank you so much for your presence here, and
thank you. I'll do my best for that. It was a very, very good idea. Let's go. Let's start.
Thank you so much, and I'm pleased. So the next presenter in this conversation will be Professor Yunkap, which is a good partner in this Health Data Forum also, the International Society of Telemedicine and eHealth. And I'm very, very pleased that Professor Yunkap Kwankam, which is now based in Geneva, hopefully also safe there when you're from your location, is going to address us in this opening session of the EU-India Mashup Day. Professor Yunkap, the floor is now yours.
Thank you very much, Paolo. Good morning, good afternoon, good evening to everyone, depending on where you are in the world. This is such an impressive opportunity here for me, learning about InfoMed, about INL, and boy, listening to a member of the political class who has such understanding of the digital health world as Honorable Maria-Manuel. I'm really impressed. Before I launch into what I had to share with you earlier, let me just make a comment on two things that, that I've heard so far. This is about EU and India. I'm here in Switzerland, not in the EU, not in India. I'm from Cameroon, which is in Africa. So apparently out of the picture, but what I've heard so far is so translatable to all parts of the world. And so I think all of this that goes on here today, if it follows in the same vein, will be quite applicable to other parts of the world. The second thing is that when I was at WHO and Margaret Chan became Director General, she said she wanted her tenure at WHO to be judged on two criteria: health in Africa and the health of women. Presumably the greatest challenges, that the health world faces. So I think many of what we've heard today, including some of the latest frontier technology, discovering, measuring, or identifying particles that might carry the coronavirus, are relevant to all parts of the world. And now, Paul, I did want to share some slides. I don't know if I'm allowed to.
Yes, please,
I
by
could?
all means.
All right, so I'll just share my screen and launch into what I had prepared. Right.
We're seeing your screen now.
Yes. Can I start the presentation? There we go. You see? I don't see my, oh, there we go. Very good.
It's perfect now. We have it.
Excellent. Yeah, just a little bit about some background about myself. I'm engaged in the field of digital health in three roles. One, I run my own consulting firm called Global eHealth Consultants, engaged in policy and strategy for countries, organizations out of Geneva, Switzerland. I'm also chairman of a startup, Telenet Health International, with a platform that is aimed at preventive health and remote patient monitoring. And thirdly, I serve as the executive director, as you've pointed out, of the International Society for Telemedicine and eHealth, which is a federation of professional societies in 37 countries with institutional, corporate, and individual members in another 60 plus countries. So in all, we have a footprint in over 100 countries and territories. Our mission is to facilitate the international dissemination of knowledge in telemedicine, eHealth, or digital health, and to provide access to recognized experts in the field worldwide. Now that's quite a tall order. The ISfTH has been an NGO in WHO parlance, we call them non-state actors, in official relations with WHO since 2008. This means that we can attend governing body meetings of WHO, such as the Executive Board and the World Health Assembly, where all 194 member states of the organization meet annually to ponder issues of global health significance. Now, it's in this capacity that the society organized a side event at the 71st session of the World Health Assembly in Geneva on May 25th, 2018. The panel discussion was on artificial intelligence and digital health in general for strengthening health systems with a focus on the health workforce and delivery of quality services. It was jointly organized by a foundation called Fondation Botna, together with the WHO Department of Health Service Delivery. The purpose of the event was to highlight the role and importance of artificial intelligence and digital health in the WHO program on Integrated People-Centered Health Services, IPCHS, and the potential contribution to the attainment of universal health coverage. This event was aligned with the WHO's agenda for the World Health Assembly in the area of digital health, and the event actually informed some of WHO's work in the area of digital health as they were preparing the strategy at the time. As you can see from this slide, the countries involved were Nigeria, India, Tanzania, and a department from WHO and ourselves, the International Society. Earlier that day, the gavel had come down on a landmark resolution of the World Health Assembly, and Union Minister for Health of India, JP Nadda, had sent out this tweet which says, "I'm happy to share that the landmark resolution on digital health initiated by India was unanimously passed by the 71st World Health Assembly." And as you all know, that was a real watershed for the world in terms of policies, global policies on digital health. This session is entitled Healthcare and Digital Transformation in the Developing Regions, Building Win-Win Partnerships. I therefore thought I would share my thoughts from a paper that I published in the WHO Bulletin some years back, which by coincidence is titled Successful Partnerships for International Collaboration in Health, the Need for Organized National Infrastructure. The ideas translate quite naturally from the eHealth era to the digital health age. We argue in the paper that while evidence of benefit is important in digital health adoption, it represents only the supply or push side of the equation. Technological determinism notwithstanding, pull forces are needed in many countries of the world if digital health is to be transformed from the passion of a select few individuals to a mainstream activity that affects the entire health system. And to achieve such widespread acceptance, digital technology has to be woven into the fabric of the national health system at both policy and practice levels. This singular but fundamental tenet leads logically to the requirement that the digital health space be organized professionally within countries. We then presented, this is some of the promise of digital health, you can see there. We then presented this framework, which is a basic conceptual framework for digital health in any country, particularly countries with centralized structures like many developing regions have. It has positive impact in countries, and it has these 5 blocks. I'm not going to talk about each and every one of the blocks, but suffice it to say that national eHealth or digital health councils are key, together with having a professional core of digital health experts and steering committees. But I'll focus on the 2 remaining components, which is starting from the bottom, digital health professional societies. A national digital health society needs to be created in countries to act as a forum for digital health professionals to exchange ideas and share their knowledge. It should be an independent, not-for-profit, non-governmental body, and such a society could develop and store resources for digital health and raise the profile of digital health experts to facilitate the sharing of experience with other professionals outside the country to mutual benefit of all involved. The society should be affiliated to one of the international federations in this space. We know that civil society has shown in the past that it is important, an important element of the value chain. If, as the honorable member parliamentarian has mentioned, if civil society, which in most cases would represent the end users, are not involved in the development of technology, chances are that leads to huge problems in the adoption. So the ISfTeH framework not only incorporates users, but also extends their role beyond transformation of ideas into goods and services to the three preceding stages in what we call the innovation value chain, which are identification of the challenges to be resolved, that's facilitation, research to find solutions, discovery, and dissemination of the results, diffusion. So translation being the fourth stage, and that heavily depends on civil society. The next element that I'd like to talk about is the centers, or better yet, networks of digital health excellence. In 2005, when the World Health Assembly passed a resolution on eHealth, one of the calls in that resolution was precisely to create and share knowledge, create mechanisms whereby knowledge can be shared among users and practitioners. Such centers or networks could also gather and analyze relevant information, both nationally and internationally, and then distribute the results nationally to support digital health activities. Again, many of these points were touched upon in terms of the EU experience. They're quite direly needed in many parts of the world. The paper that I referred to earlier also underscored the statement by Eisenbach, which characterized digital health, or eHealth at the time, as a commitment for networked global thinking to improve healthcare locally, regionally, and worldwide by using information and communication technology, or more briefly, digital technology. The paper also outlined three collaboration models into which organized digital health professionals can tap to improve their own experiences. One was the Commonwealth model. The Commonwealth has since created its own network of digital health. The other was the Rockefeller Foundation, which in 2008 organized a series of meetings on eHealth in Bellagio. As you know, when the world faces a challenge and the Rockefeller Foundation is involved, they call a meeting in Bellagio to resolve these types of issues. The third then is the international federations, groups like ours, which bring together professional societies in countries. Another is the International Medical Informatics Association, which is also a non-state actor in official relations with WHO. We concluded in that paper that a well-organized national infrastructure for digital health can help make efficient national digital health systems a reality in any country, regardless of their state of development. And the framework could be a powerful tool for supporting the internal transformation of digital health into a mainstream activity for the entire health system. I would be remiss if I didn't mention this last aspect of the work that we're doing at the International Society for Telemedicine and eHealth. We call it the Global Knowledge Commons, and it's a mechanism for answering 5 basic questions. It says, who is doing what, where, how well is it working, what can we learn from it, and what can we share from it? We believe this ethos is key to making digital health a reality and to strengthening pull forces in countries so as to make the best outcome out of what we know. If we could share more clearly what we already know among ourselves, we believe there are very few problems that we would not be able to resolve. And in fact, there is some argument for the thesis that we should spend a little bit more effort on applying what we already know, even as we try to learn, discover more things, scientific facts, and innovations. So this is what I had to share with the group today. The International Society is available to collaborate with all comers. We encourage you to join us and involve us in your activities. I thank you very much for your attention, because our work can produce a lot of benefits in all areas. Thank you very much.
Thank you. Thank you. Thank you so much, Professor Yunkap, for this wonderful idea of creating a global society on the civil health. Your thought leadership is very much appreciated in the sense that you have experienced and you pioneered the digital eHealth initiative at the global level in UN, and more power to the UN is also something that we will all endorse. Now with us, it's Dr. Rajeev Singh. It's really a pleasure to have him here. He's the CEO of the ICC, Indian Chamber of Commerce, and it's so important to have also from the civil society a strong representation in terms of the business community of India. It's very fortunate that from your busy schedule, Dr. Rajeev, you could take some minutes to be in this Health Data Global Hybrid Summit. You are making it really global right now because addressing us from India, and definitely the floor is all yours now.
Thank you. Thank you, Paul, for inviting me. I'm happy to be here with you and also with other eminent experts like Professor Lars Pontelius, Professor Yunkap, and Honorable Maria-Manuel, and others. Few words about the Indian Chamber of Commerce. I represent ICC, that's how it is known, which is the oldest national chamber in India, headquartered in Kolkata, but having regional offices in Delhi, Mumbai, Hyderabad, and 5 other cities of India. And as you know, India, the way India is structured, the national government plays very important role, but the state governments also play important role. I mean, what you may call the provincial governments or the state governments. And ICC will be happy to work with all of you and support any initiative which you may like to take up in India. Now, I don't think there is any doubt that digital healthcare today is a compulsion, and it's not a choice. COVID has provided the necessary push in preparing India and all other countries in taking a big leap towards digital healthcare. There has always been a need for better remote digital care to fill all the gaps in the current healthcare system. But COVID has exposed the urgent need to bring the entire healthcare up to the date so that the digital tools which exist can have the greater impact. Now, given the above, India over last few months has responded very proactively and positively to COVID. And I think not only government, but the people, the Indian medical fraternity, they all worked out new and innovative solutions to service the people. And just to give you a sense, the doctors used video calls, which doesn't cost much, on WhatsApp or Zoom or Google Meet to reach out to the patients. Fortunately, smartphone has very good and deep penetration in India. And last year, India reached, India crossed 500 million smartphones. And I think by the end of 2021 and by the end of 2022, the numbers are going to cross over 800 million smartphones. And doctors could give the prescription through the phone calls, medicines, and of course, these were for the routine issues. But in terms of COVID, because of the lockdown and other measures, like India was not manufacturing enough masks or the gloves or ventilators, but through the public-private partnership, within few months, today India is self-sufficient in many of the areas, and in some cases, India has also started to export. Now, all this is inspiring and gives a lot of confidence about the future of digital transformation in India. Today's theme is how do you create the win-win partnerships? I think the real question is, how do you implement technology-driven, transparent, efficient, cost-effective, yet collaborative models to achieve digital healthcare? There are regions which need innovative and win-win partnerships. Let me first talk about the Indian market. I think year 2020 has seen influx of AI, telemedicine, and the use of remote technology much more in India compared to past. Both government and the private sector have contributed towards it. With the introduction of schemes like Modi Care and Ayushman Bharat, healthcare has now reached larger number of people, and government is, including the private sector, everybody is aiming to accelerate this access and reach with the use of the digital tools and the technology. It is expected that Indian healthcare sector will reach US dollar 372 billion by 2022. And the main contributors are basically the rising middle class, more expenditure on health, and lifestyle diseases, and many others. And of course, health insurance is also gaining momentum in India. It is expected that 2020 would give a big push to the era of digitized medicines in India. Health data will spread across the people and will be pervasive. New tools and models are being used in India. There are well-networked laboratories, and they are spreading their reach across the country. 2020 has already emerged as the year for bots and the cloud services in some parts of India. On the clinical side, automation for diagnostic methodology and analytics is emerging as one of the focus area. The cloud computing market in India is increasing exponentially. In 2018, the market was almost US dollar 8.5 billion, and by 2025, it is expected to reach US dollar 55 billion. Cloud computing is providing instant access to the patient data to the doctors through secure interfaces. Telemedicine is a fast emerging sector in India, and with the adoption of AI, the whole sector is reshaping. And this market is going to grow in India. Another data I would like to share with you, and that is the Future Health Index 2019 report says India is leading in the adoption of digital healthcare technology, with 76% of healthcare professionals in the country already using digital health records in their practices. Obviously, the number has to grow, and the reach also has to grow. But I think to begin with, it's a good number, and both the public sector and the private sector are making the right steps in the right direction. Another strength which India has is a very vibrant startup ecosystem of digital health startups, which provide a vast backdrop for cost-effective solutions. The startup landscape within Indian healthcare ecosystem goes well beyond specific diseases therapeutic area, geography, type of products, services, or business models. Digital health startups are bringing novel technologies such as wearable technologies, telemedicine, genomics, AI to the Indian healthcare system. India has more than 5,000 startups in the health technology space. Healthcare has also seen significant amount of investments over the last few years. In 2019, 53% of the angel investments were towards the healthcare, supporting the startups. In Q1 of 2020, investments into the healthcare sectors witnessed an increase of 14% in terms of value. That only indicates the priority healthcare sector is getting in India. Another area where India has made good progress is digitization of healthcare records. Certain hospitals like Tata Hospital for Cancer Care, they issue a digital card to the patient, which he or she has to renew every year. The moment the patient reaches the hospital with the card, the doctor in charge can view all the latest medical data. So this is a small example of one of the hospital using the healthcare records. In the backdrop of the pandemic, Prime Minister Modi has launched the National Digital Health Mission, which will create an open digital health ecosystem and is expected to serve as a backbone for integrated digital health infrastructure and provide a platform for private innovations also. The National Digital Health Mission has potential to unlock, as per an estimate, $200 billion for the Indian healthcare industry over next 10 years. And the adoption of an open digital healthcare ecosystem will mark a fundamental shift in the way healthcare market currently operates. The contact tracing app, which you must be knowing or you must have heard, Arogya Setu, built by the Indian government, has achieved remarkable success in countries' fight against the COVID-19 pandemic. India is also partnering with many countries towards the vaccine. Now, this is a brief about what India is doing right now. However, when we are talking about the win-win partnerships among the developing economies, I think there are some challenges. Availability of finances is one of the challenge, and it is more important today because of the COVID-19. 80% of the population in the developing countries still depend on the government healthcare, and that too at subsidized cost, and government is supposed to basically take lead, invest in healthcare. Economies are already under pressure, although healthcare is still getting high priority in most of the economies. Now, what it means at the corporate level, if a company was launching a new tech and that's not important for immediate survival, then such products are getting deferred. And that problem, I think, will remain for some time, maybe at least another 1 or 2 years, and then we have to see how things evolve. Another big challenge is the challenge of education and awareness, because we are talking about the developing economies, and you have the rural population, you have the semi-urban population, underdeveloped regions where the literacy levels are low and the technology awareness is also low, although it has been rising gradually in most of the regions. Third challenge which I see is the basic and the reasonable healthcare infrastructure, where many developing economies or underdeveloped economies are still struggling to have access to the basic facilities. Fourth challenge, which is again important, is skilled human resource, especially for the regions which don't have good access and good infrastructure. The next challenge which I see is the cost-effective and affordable solutions of digital healthcare and the basic access to healthcare. The last point in terms of challenge, I think there is a need to have more success stories of public-private partnership, and especially success stories which are commercially viable and which are scalable. Now, there is a rapidly increasing need and demand for the healthcare services, and they put immense pressure, and especially this has become more relevant in the times of COVID. The huge pressure on all the stakeholders in the entire healthcare value chain is something which we will have to keep in mind. Another challenge which I see is the modernization in the healthcare medical technology. The hospitals require a lot of data for clinical decision making and research purpose. There are technologies available to capture ICU related data for improved clinical care, but still lot remains on paper, or it is entered in the information system by the additional manpower. And since the clinicians have a time constraint in feeding the data, especially when they have to visit multiple hospitals, so many people, huge numbers, I think the feasible game changer could be the use of voice recognition tools, which is capable of attaining close to 95 to 100% accuracy for complex medical terminologies. And I think with the use of voice recognition, hospitals can make the entire data management system paper light, if not paperless, at least in the short term. I think the developing economies and a country like India, some private sector companies have also created success stories in terms of low cost and affordable solutions for the patients, low technologies, equipments, etc. But I think there is a need to have more and more solutions like this, which can give access to the masses to the digital healthcare. Let me also highlight here, in terms of Indian example and the Indian experience, thanks to the Digital India Mission, for the first time, as I had mentioned, India crossed 500 million smartphone users in 2019. And by 2022, there will be almost 820 smartphone users in India. Another good news is that for the first time in 2019, India had more internet users in the rural areas, in the villages. India had 227 million active internet users in the rural areas, which is 10% more than the urban India. Now, that is a platform which can be accessed by the healthcare system to reach out to masses and to give them access to mobile-based solutions, healthcare apps, and also to provide healthcare to the people. Here, let me also mention about a success story which Rwanda as a country has created. Rwanda is one of the few developing countries in the world to have universal health coverage for 90% of the population. They focused on the technology And as a result, the government invested in broadband infrastructure that now covers 90% of the country, and the penetration of mobile phones has exceeded 75% of the total population. Now, this has given huge access for the healthcare system to the people, especially living in the rural areas and the difficult topology. And I'm sure there are many such examples which exist. The last suggestion I have is, I think for these partnership models to work, I think the regulatory framework and the ease of operations also has to be looked at. And there is a need for a collaborative effort to take everybody together, not only government, not only the private sector, but the community and everybody. Here I would like to quote the global head for digital health strategy at Roche. He says, "It's like a call to action that allows us to launch more disruptive models of care. It won't work for us only to build digital tools and expect that they will be adopted into existing clinical practices. We need to redesign the ecosystem. Every country will need a customized approach." With these words, I would like to stop here, and thank you once again. Thank you.
Thank you so much. Thank you so much. And I think it's such a wonderful chance to have you here and share the wisdom about your country. You have on an in-depth knowledge of India and as a country, as a society, and also as a market. And it was really enriching to have this information here shared with us. I would like now ask you to be here for just a few minutes. I'm going to show you a video of the WHO and then ask you for the comments on this video. Because for one thing, it's sure, and if you allow me just to share here a little bit of an information that probably everybody already knows, but it's interesting to see why it makes total sense for the European Union and India to have a closer connections, because our identity in the values, we are probably the most regions where very similarity in values, and the combined population of European Union countries and India can make really a balance toward the new leadership we need in this world. And that's something that we would like to work forward in 2021. And this health data forum is specifically concerned with digital health is our focus. I will now ask your attention for a video I would like to share. This video is also highlighted on the pages of our internet health data forum. It's let me just sorry about this. Just bear with me for a moment. I make a wrong choice here on the pages I need to share. Let me think where this is. Yes, now you're seeing the Health Data Forum webpage, which is, by the way, I also like to give a good thank to our partners, our major partners, Glint, INL, and Novartis, for making this possible. Also, our SME partners, founding partners, our event partners, including KikoChat, this platform we are all using, our venue partners, our strong supporters and friends that help this, and we are proud member of INS. Also, it's a partner innovation exchange, Digital Health Portugal and eHealth. We are supporting us for this initiative. And as you see, the World Health Organization is pretty much on top of our priorities here. And this is the video I would like to share with you all. Let me just make sure that I can share this video with enablement of this audio of the computer, so that you can also share this short. It's a partner innovation exchange, Digital Health Portugal and eHealth. We are supporting us for this initiative. And as you see, the World Health Organization is pretty much on top of our priorities here. And this is the video I would like to share
love
with
waking
you
up
all.
early in
Let
the
me
morning
just make
and
sure
going
that
for a
I
run.
can share this video.
For me,
with,
it's not just about
enablement of
staying in
this
shape.
audio of the computer,
It's a way of life.
so that you can also share.
There are so many tools I can use to motivate myself and to access information to help me reach my health and fitness goals.
And as you see,
This watch, for
the World Health
instance,
Organization
shows my
is
heart
pretty much
rate
on top
and
of
tells
our
me how to
priorities
sleep.
here. And this is the video I would like to share.
I also use an app to keep track of my overall state of health. For me and my level, it's not just about staying in shape. It's a way of life. Health technologies like these, there are so many tools very much part of my life to motivate myself, and their constant information continues to help me reach my health and fitness goals. Take, for instance, the work of this professor researches Delon and shows my heart rate from the sun and tells me how to sleep, and Centro Internacionale I also use an app that is helping bring my overall state of health for me and my level, keeping just about staying and staying safe. It's a way of life. Health technologies like these, there are so many very much part of my life to motivate myself, and their constant information to help me reach my health and fitness goals. Take, for instance, the work of this professor researches Delon and shows my heart rate from the sun and tells me how to sleep, and Centro Internacionale I also use an app that is helping bring my overall state of health for me and my level, keeping just about staying and staying safe. It's a way of life. Health technologies like these, there are so many very much part of my life to motivate myself, and their constant information to help me reach my health and fitness goals. Take, for instance, the work of this professor researches Delon and shows my heart rate from the sun and tells me how to sleep, and Centro Internacionale I also use an app that is helping bring my overall state of health for me and my level, keeping just about staying and staying safe. It's a way of life. Health technologies like these, there are so many very much part of my life to motivate myself, and their constant information to help. Digital technologies are here now. They provide insight and benefits that can help us better manage our health and well-being. We need to make sure they are safe and inclusive. We need to be part of this change. That's why digital health is a flagship initiative of WHO Europe's new program of work, the European Program of Work. Let's commit to united action for better health. They provide insight and benefits that can help us better.
So I hope that you enjoyed this video, and now I will kindly ask you for a round of comments on this. In what way these initiatives in Europe can also have applicability in India, and what is it that we can benefit from this relationship, EU-India? I would maybe from the start, Honorable Maria-Manuel Leitão-Marques could start the round, and then Professor Yunkap, and finally Dr. Rajeev Singh.
Thank you very much, Paul Nunes. So, as I told before, first I would like to thank all of you for the marvelous interventions. So interesting, all of them. And also, I visited Rwanda, and I was impressed how last year, and so I also was impressed. They use digital to improve quality of life of people, not only in health, but in different ways, also to payments for women, to prevent violence, domestic violence, and so many very, very interesting projects as Miss Geek to digital education of girls. So many ideas they are spreading to different countries in Africa and also to different countries in the world. So it's a very, very, very impressive country. And so it's very interesting to see what India was doing to use digital, because with digital and telemedicine, it's very important. We can get people from rural areas with very good doctors and specialists, and is a way also to spread good health care for our people. and this is a tool for development. For the European research, this is a very good project. There is also a very interesting ideas in EIT, European Innovation Technology. We have a health community in this European Innovation Technology. And so there are many opportunities to spread this cooperation for researchers. As I told before, I think we need to work on data. To work on data means work on standards, technical standards. If not, we need to say that in European Union, maybe in Portugal, I'm going to be a little bit provocative. We need better data because I'm not sure we have good standards even among our hospitals and so on. But so COVID showed us a lot of things we need to improve. But if it's possible to have standards, to have European data, and also with common standards with India and other countries that are concerned with this importance of research in health, we can go faster for research and also for healthcare, for our healthcare systems. So invest on data is for me important priority, but as I told before, it's very important that data are my data, your data. It's data of our patients. It's not the data of the system. So we need to keep trust of our patients when they allow us the use of their data to research and to healthcare. So we need to work on these concepts of data donation, data dividend, and sharing results with our patients is also very important. But there are a lot of opportunities, and we need to be prepared to this challenge. It's why I said before in my presentation, I'm available to work with InfoMed and other institutions and also with our colleagues from India. It's very, very important, as I'm doing with Latin America, in order to discuss, not to impose, but to discuss what we are doing in Europe, in European institution, concerning ethical principles, concerning regulation, concerning experiment through regulatory sandbox, and starting from the very beginning to share our values, our principles, our ideas on how to regulate, how to preserve privacy, data donation, and so on, in order to go faster in innovation. It's not to stop innovation, is to, because we are very interested in go faster in innovation, but we need a responsible innovation and an open innovation, and to keep trust of our people on that. So I'm totally, this is a very interesting idea and very interesting project, and we need to work together, lawmakers, researchers, doctors, and of course public institution regulators, in order to go faster for the future in healthcare. Thank you very much.
Thank you so much, Professor Yunkap.
Thank you, Paulo. I think that was a very fascinating video from WHO. Again, just shows that there's innovation taking place all the time. I have a number of comments, though. We are fortunate that we saw this video, and I can tell you, just this morning I read a piece where Fitbit can now use the data that they capture, particularly about heart rate variability, to identify at better than 50%, with 70% specificity, asymptomatic cases of COVID. Okay, now this is all wonderful, but I bet this video, which talks about wearables, etc. I bet there's somewhere, a group somewhere on this planet that is researching exactly the same issues, but because they haven't seen this video, are not able to leverage the fact that this video exists, that it's already been done somewhere else. My thesis is that if there's hardly any problem that you can encounter in the area of applying technology to health, which has not been thought of somewhere else, perhaps even for which a solution has been found, but we don't know. There are barriers to sharing of knowledge which create duplication of effort. As I was saying, this same solution that is being presented in that video, I can bet that there are other researchers working on perhaps even identical types of solutions and duplicating their efforts because they're not aware that this has happened. Hence, the emphasis on a global knowledge commons where people can share what they know. There's a famous quote, Jim Grant, when he was executive director of UNICEF, said that during his term as executive director of UNICEF, 80% of the children who died could have been saved because the knowledge to do so was available. It just wasn't available where these children were. That's a major challenge that we need to solve with innovation. The second thing I'd like to say about innovation, which is a good thing, by the way, to echo Honorable Maria-Manuel's point about the regulatory environment. When WHO passed the famous eHealth resolution in 2005, we were asked at WHO, we can't do everything. What are the key things that we need to do? And WHO identified 8 areas, priority action areas for eHealth. At the time, there were 4 application areas and 4 enabling action areas, 2 of which have been touched on very deeply here. One was the regulatory environment within which digital health takes place, the ethics, the legal aspects, et cetera, et cetera. The other one that Dr. Rajeev talked about was the whole area of public-private partnerships for ICT R&D. Traditionally, a lot of technology in health came from technology that was designed for something else, but now leveraged to produce health benefits. Why not develop partnerships specifically to leverage ICT in the area of health? So two points there. The third thing I'd like to say is that, actually 2 more points. One is equity, about equity. Technology is such that if you study the trends in technology, technology does 2 things. One, it tends to raise average. Averages go up so that everybody's doing a little bit better. But there's also a tendency for technology to skew even further the disparity between groups, especially based on income levels, because of the ability of people who are wealthier or better off to adopt and adapt and use the technology more than those who aren't as well off. So in promoting the use of innovations and technology, digital technology in our case, we must also develop programs which try to minimize the inequalities that are created by technology in many instances. And then the final point is that I personally believe that the greatest opportunities for digital technology in the health sector lie not in curing diseases, but in producing health. If you look at health as a multivariate function and the pathways to health, there are many opportunities for digital to intervene in these pathways to good health and not wait until people fall sick and then you try to do your best, including in the case of pandemic preparedness and prevention. You know, there's so much we can do if we don't wait for things to collapse before we try to fix them. So I think digital has many more opportunities in production of health than in the curing of diseases. Thank you.
Thank you so much. And this is a great interview.
Great intervention. So last but not least, Dr. Rajeev, and your closing comments, and we'll complete this session.
Very important to predict instead to cure. Very important. Totally agree.
Absolutely. I think Dr. Yunkap has already captured all the points which I had in mind.
Oh, thank you. Thank you, Rajeev.
Actually, the last point which you made is something which I wanted to mention because like the Fitbit, the way people in India have adopted smartphones, and I'm sure all over the globe, you look at the rural people, you look at the people with lower income, you have so many options in smartphones. By spending maybe $50 or $70, $80 or $100, you get a normal working phone, and it has all the features. So, and also the big data. So if these variables or something which is based on the mobile platform, if you have solutions which capture the data of masses, and you have like the system raising the alarm and keeping each individual or each data point or the data source informed about what's happening to him, what is going wrong, what is not going right, and with like having a combination of big data, artificial intelligence, little bit of hardware, whether those are the variables or whatever, and you like pull in the data from the masses, and then the system highlights the areas where you can improve your health, you can work on your health. The system itself can caution you, and I think prevention is definitely something which the digital healthcare should look at, because that is the first step. And then when it gets to the next level, obviously you need doctors and you need specialists, and again you have the technology. Another important point which Dr. Yunkap mentioned, I think the startups and the technology being innovated all over the world. I think Europe has definite strength in technology, and India is known for its expertise in software development, and like so many Indians working all over the world, in US, in Europe, everywhere. I think the partnership will really be very, very meaningful, and there is a need to involve the youngsters and maybe have opportunities or the platforms where the technology can be pulled in. And the technology has to be affordable, because if you look at the profile of population in Asia, in India, in Africa, many other continents, I think large number of people need cost-effective solutions. So with the combination of all these and the platform to share the technology, also how do you empower the communities? Because I think the communities play a very important role, and there again, little bit of training, little bit of digital infrastructure can really empower the communities, and it would make feasible for the technology and all the government schemes expenditure to also reach people in a targeted manner. Otherwise, sometimes there is a lot of transmission loss in the process in terms of the schemes and the policies and the funding, and in the transit, a part of it gets wasted or repeated, So I think it's very important to have mechanism to capture the success stories. And the video which Paul shared with us is truly inspiring, and I think it makes a lot of sense for the people living in the developing countries. Thank you.
Much, and we are here now in the end of the session.
Like this, do you hear me better? Okay, it's the end of the session. It's the large auditorium. I'm here, and definitely we've seen here such like the carrot that we can work for, the prize, the big prize of having digital health used in terms of prevention and make a healthier population with digital health. But on the other hand, we have to have a lot of work from the regulatory to have the people to trust the data. And this has to be consensus work, parliamentary work. Honorable Maria-Manuel already said that, and also civil society needs to be involved. This collaboration on making sure we have proper regulations so that the population trusts the data, and then the data can work for the population. That's a magical formula that we need to work very hard to achieve in 2021. Thank you so much, dear guest speakers. I hope that you can still remain in this initiative for the next upcoming year, so we can have this as a call to action for your leadership. Your contributions were really fundamental. Thank you so much, and it was a real pleasure. I ask everybody in the room, please light up the cameras and a round of applause. It's okay to show yourself now that we are here watched by so many people joining us. Light up your cameras and please applaud, because it's good that we see virtual does not mean distant.
Very good. Excellent.
Thank you so much, everybody.
Bye.
Thank you.
Thank you. And have a great day.
Have a great day and the rest of the weekend too. And then we have a small pause now for 30 minutes until 11:30 UTC.
Very good to meet you in a virtual way, but I hope we can work together in the future on these matters.
Absolutely.
It's very important.
This is just the beginning.
This perspective, using data, using digital to empower our people and to accelerate development. This inclusive way of digital and not only a market question. It's my mission in the parliament.
Very good.
Thank you.
Excellent.
Definitely. And also Professor Las Montelis that joins us in the last, just to say goodbye. It's really a pleasure to
yes, and we are waiting for this way to be social again, because the parliament is virtual now.
Yes.
Yes, absolutely.
Okay.
So 30 minutes break now, and don't forget that we have also the pub and the beach. So if you leave the keynote chat environment, you have also other places you can meet, and you have the INL booth, which is a special dedicated Zoom room where you can have also some interactions with INL. Gerard Bourbon is also here with us in these meetings. So enjoy your space, enjoy your time in the keynote chat. It is a virtual space for this conference, and I'll be back in around 20 minutes.
Okay.
See you later.
Thank you, Paul. Thank you.
Bye.